Welcome back, chameleons, to my channel of Aspie Answers. As your host, Aspie Answers. As your host, navigator, educator, navigating through life with autism and mental health, my lived experiences to give you a few tips and advice along the way, as well as taking you all on a journey. So if you're interested in these and more, feel free to take the time to subscribe or follow me on the following social medias listed below of this podcast today. So, doing my research for episode 3 to continue on for you guys based on the self-diagnosis and diagnosis series for autism. Hopefully you'll enjoy these, and in saying this, hopefully we'll learn from each other today about some of my viewpoints as an autistic adult. Just to bear in mind also to kindly, if you see it live on my channel, also be kind in the comments when I'm open this floorboard of discussion, because some of those may cause a bit of a debate, but hopefully each their own. Respect people's differences of opinion and agree to disagree or what have you based on these everyday topics. So I want to also welcome you newbies onto my community right now of this, and I'm hoping that you can get to know me more as not just an autistic but just a person in general behind the diagnosis of the channel versus the podcast and everywhere else you may find me, so that hopefully we can gain a better understanding and what have you. So earlier I just been mentioning about like the topic, is self-diagnosis worth it for getting an autistic diagnosis? So you can find this hopefully later on in the piece, either through my channel or my podcast, or it should be hopefully live on my podcast, to revert back to this one before I continue on to the next one, which is the pros and cons of getting an autistic diagnosis. So as we know, it has been stated that it has been a hot debated topic many years now, we could say, as many people have been talking about it, or just people in general before during the diagnosis process will have maybe mixed variety of opinions on this. You'll know that there are a lot of adults out there that are autistic that has been now classified as self-diagnosed autistic, and some may believe or choose to not wanting to get some medical professional diagnosis for autism. That's fine. Again, that's based on their choice, give or take. Some people agree and say yes to go and do it, and then you have some others' opinions and or choices to say that why bother to have a diagnosis, as it's a waste of time and energy, etc., to get the diagnosis. Don't get me wrong, I know I agree with you wholeheartedly, but sometimes for me, based on my personal experience, when I was going through my diagnosis journey of what was going on with me before I transitioned to an adult, basically I felt in myself that I would rather know than not know, and hopefully pray and hope in the future, as I shared in one of my videos, basically that there'll be more services and support for autistic. So as I'm saying here, like I said, that if you are thinking of getting a diagnosis, and you are suspecting that you're on the spectrum, or if you're self-diagnosed and that you're thinking again to yourself, is it really worth seeking an official diagnosis? This video and or podcast, wherever you're going to be watching or listening today, should hopefully give you some guidance to make your final decision, along with answering some of your questions for you, hopefully. So no rush or pressure. Again, this will be again based on your own choice of what you want to do next after you may hear this from me. Sometimes also, in saying this again, this will be based on your everyday circumstances and situation that you're in to make that choice for yourselves. There are a lot of things to consider when getting a diagnosis, and what I've done here is hopefully I've written some pros and cons as a listing. As you all should know me by now, I'm all about lists to help with my everyday executive function. I'm like that. That's just me. So that hopefully, in saying this, that you'll be able to know more to the reason why I do certain lists, be it pros and cons, to do this and everything else, hopefully in my video, which I'll link in the card above me today if it's live today, and that hopefully that will give you some more information and insight about it all. And in saying this, with the list that I've laid out here on the pros and cons, that there are bound to be more to add, so to speak. So this is the time, after you've finished watching my viewpoints and what have you on the listings, feel free to comment them below of the ones I may have missed, of the pros and cons. We can obviously open it for a floorboard of discussion. Today I'll go through as many as I can, time permitting, and we'll cover the main important ones or common ones that I have heard about, or we may have heard about at least. So the very first part we'll go into will be the pros. Pros are here is rewarding relief, awareness and support, self-aware, self-accepting, mental health accommodations, help, support, funding, community, sense of self-belonging, certainty, confidence, advocacy, connecting with the autistic community, support, advice, right treatment, therapies, being accepting of others or even myself, loving myself for who I am, not by this label, as I said, I don't like using this term label, so I'll say not just by this diagnosis, but as a person in general that's learning and growing every day based on this, navigating through life with autism. Giving myself permission to avoid anything that may trigger my senses, for example, to avoid any of my sensory overload, meltdown stages or phases, to know the signs when they're coming and going. This is a key point that I need to share with you all based on meltdowns and that, even though I have shared it before in one of my videos right now, that certain times of day, like, well, me, sometimes I'm self-aware right now about what's going to happen if I am about to have a meltdown, shutdown, or what have you, phase of these stages that many of us autistics go through, right? So it's no pre-hand when it's happening and what have you. But I have just to share a classic example, hopefully, to give you an understanding. Hopefully, as I'm sure that this is like many of us sisters that I have talked to or met, that say I'm walking down the street and it's really busy, you got traffic going, and then you may have some roadworks on one side of the traffic, a noisy sites going on, building something, be it like shopping complex, and you got, you know, hammers going, you got the drills going, you got the everything going around you sort of thing, and then you've got sirens going off while the police officers, you know, chasing some sort of person that it may be speeding or whatever it may be, and then you may also come across an ambulance, you know, that's driving past you to, you know, attend to the accident site if there was a suspected ambulance or chasing a suspect. And obviously I'm saying this, for me, if there's too many noises going on, be it white noise, you know, and what have you, I will really amp up the ante of my meltdown sort of thing, because obviously absorbing all that white noise, like I'll spun. Sometimes it can be so overwhelming to the point that sometimes, for me or so, if I suspect, again, in this example, there was an accident, you know, my anxiety levels will go up, then my heart will race and everything, and then I'll end up having an anxiety attack, you know, think I don't mean to be rude or what have you, but this is based from what I have happened to me in the past, gone through this, that I may think of the worst about it, you know. Is it someone I know that got involved in an accident? When I see the flashes of the sirens of the ambulance really speedily going down the street, you know, is it one of my loved ones or what have you? Who is it? You know, all these questions will start floating up, and then it's just the point that I will really tend to explode into that meltdown state. But in saying this though, after giving myself permission, basically, or what have you, to avoid that situation or what have you, or to remove myself from that situation, if you will, it is important to do so, because I believe in saying that sometimes for us autistics it gets so overwhelming to the point that we need to find a way of treating from that area somewhere safe and quiet for us for a time to actually recover. And I feel at this point of time, from what I've learned, that like many people still tend to think we're actually get on ourselves, you know, attention seekers when we have our meltdowns. It's not an attention seeking behaviour, far from it. It's just how it is for us autistics, how we cope on a daily. Like you normal people, how you may be able to cope on a daily if you are stressed at work. Everybody copes with different means of different methods and what have you. I believe in it's just a matter of just knowing when enough is enough for us and actually take that time out, come into play basically. And this comes into the next point of like being more easier on myself for self-care. Like what I mean here is, because obviously in this bullet point, time and time again I've been looking out for others. People could probably vouch for this. I've been looking out for others and I've been putting myself on the back burner for quite some time, and sometimes I'm trying my hardest, really hardest now, to actually learn to say no when I need to say no, if this makes sense to you all. And saying this, the reason being for that is that, you know, I'm always the type of person that will yes to the point of no return, and that it's not just to please people, it's just to get the work done, because I'm always willing to help others. But it's always good to have give and take, that if I'm stuck with something, someone can hopefully, you know, come along and actually assist me, if you will. So in saying this, being more easy on myself for self-care, like not having to worry if I have to fit in or blend into the, you know, society or the group of people that I'm socializing with. Again, in saying this also, I have mentioned it has been a tough one for me, that I felt like for quite some time I had to please certain people to fit in and blend in, to also not just please people, but just to, like, again, mask myself and act as normal as possible if I was around people from 9 to 3 or whatever, especially in high school days, and just, you know, whoever and whenever I do have the chance to socialise with people. However, but in saying this, also I have now this belief that we are all born different and that we should be loud and proud to be ourselves no matter what the situation or circumstance is. We should be able to express ourselves in a way. Get example why, like we should be able to stim in public without having the humiliation from others telling us we shouldn't be doing it in public. Stimming is an important outlet for most of autistics, regardless if it's flipping hands, flapping our arms around or whatever it may be, but we need to do it in a safe manner because I know sometimes stimming can be dangerous and it's just a matter of just knowing how to go about it, when to go about it, and hopefully in saying this that we can actually educate others about it more, because I feel like at this time that many of us get frowned upon when that is happening around when we're in town, maybe stimming, because stimming is like a sensory relief for us to just release any stresses or pressures on us. Another one that I put down here in one of my bullet points for the pros is I am more self-aware, self-taught and self-understanding of myself as a person. I have always been a bookworm, reading different books, really thorough, and usually when I am absorbed in some interest I shall delve in real deep into those everyday situational or topics or whatever. Many people will know me that yes, I'm a bookworm. I am still that will research deeply into certain important topics, even though sometimes it might frustrate some people about it. But hey, this is just me. Take it or leave. If you want information out of me, well, I'll try and do my darn hardest, either A, to research it up and get back to you of a topic or whatever that you may need, and hopefully it will be beneficial to you. And then saying this also, I might do it in the mix as I shared before so many times before. Some of it might be in the mix of some tips and advice for you guys based on my personal lived experiences with autism and that, and then hopefully I could leave it with some of the tips and advice or whatever I give you. It's just a matter of respecting one another in a way, how or what have you. Another one on the pros I wrote down was some of my talent, skills, etc. that have been used to my advantage in some way or manner. What I mean here is every autistic I have met have their strengths and weaknesses. Sometimes we'll use our strengths to the point that it will actually lead to a job that will allow us to use our strengths and skill sets of what we've got. Many of us autistics will be really thorough. They can be into the point that you might miss something in a code that may be given to you guys, whatever it may be. So we may be able to do it, but don't forever assume that, like I said before, so many times before, that each autistic you meet are the same. They're not. They will have their own quirks, their own talents and what have you, and their strengths and weaknesses like many of us. But it's also just give or take, working with us, not against us, and hopefully we can actually accept one another, because like I said before, acceptance to me is really, really important. Having a sense of belonging when I am in autistic groups and all communities that are like me yet with different strengths and weaknesses. What I mean here is, like, sometimes I feel that if I'm in an autistic group or community group or whatever it is, be it via through Facebook, which I'm thankful for some of the autistic groups I'm in, especially in the ones that are New Zealand based or autistic Facebook groups that are actually trying to understand me as an autistic, because some people may struggle with it to this day, not knowing what I'm doing. But this is just me, I guess, but I am doing the best I can here to be willing to help others as best as I can. Again, some people have come to me, I'm accepting of me, yet there are still some that are still learning how I work as an autistic, but that's okay. It's not many people most likely understand and want to educate themselves. If they did want to educate themselves on what have you and understand more about autistic, by all means, ask an autistic if you need to. Don't forever just sit there and, like I said in my last video, stereotype us to the point that we don't belong anywhere. Another pro here I put is I can now freely speak out on an issue that I feel passionate about and whose stereotypes I want to challenge with the authority of experiencing it. These blogs and my opinions on what matters most to me, especially me being an autistic female adult, at least probably carry more weight coming from an officially diagnosed autistic person, or shall we say I'm a self-diagnosed autistic. So therefore, basically, in saying this, based on this, that I am forever grateful that I have certain platforms so I can actually educate, advocate people about autism especially, and that in saying this again, that it may have its downfall for freedom of speech of what I speak about. Many people might roll their eyes back at me thinking, oh, she's going to drone on and on and on, because many autistics are known for that. When they have some intense passion or interest of some of the subject, yes, they will rabble on and on and on. I am now trying to withhold some of it, but it's sometimes still hard to this day. I'm not sure if any of you that are listening that are my previous supporters or ongoing supporters, can you please let me know how I'm going with my stuff, because obviously the way I go about, communicating with others can be difficult. I still struggle to this day, maybe allowing people in and what have you, based on what I've been through especially. Another one in this is I can be who and what I am besides this diagnosis, or again, as I put here in my notes, this label that I don't want to use, the term being able to express myself, even if it is during the times that are overwhelming for me, that I should be able to be doing something of any kind in nature without having to be looked at, frowned upon, etc. by others. So again, it's all about self
acceptance for myself and hopefully acceptance of others that are either autistic or non-autistic. And therefore, in saying this, that I feel that there is still a bit of stigmatization and stereotyping based on certain autistics, how they behave in everyday's world. But again, that will depend on each and every different person. While we are transitioning from a child to an adult, that sometimes we may be like a bit of space and peace and quiet, especially when it comes to the time of sitting our exams, etc. Well, this is a key pro for me, because when I was into my intermediate high school right through to uni years, like, I had to express to some of my lecturers, teachers, what have you, or whoever that was around me at the time, that I do needed a bit more time on my hands for sitting the exams and being in a quiet room with no noise or whatever, then I can fully concentrate and maybe, I don't know, have certain other needs if need be, like if I had to block out noise or whatever, to put some headphones in or something, or some of the fluorescent lights that were around at that time that gives me headache, make me ill and dizzy, sunglasses on inside. Many people will still look at me to this day, especially like people making jokes about it, not sitting inside while you're wearing sunglasses or whatever. You question me on that. It's just a form of accommodation need for myself when I'm indoors of certain buildings. Some of the lights are stronger than others, and I need that to prevent me getting dizzy, lightheaded, and maybe that makes me want to throw up. So some of us may enjoy being by ourselves for a time. Some of us autistics enjoy our own company. Some of us don't, but we don't want to be excluded from the group. So in saying this though, please, if you see us and want to ask us more about our autism and stuff, feel free to actually include us in our everyday activities. You'll be probably surprised what we can do. Get sports or whatever. We're not trying to be smart asses of intellect. Far from it. We're just our own quirky self. We all have our quirk, autistic or non-autistic. Sometimes with our interests and hobbies that may lead to full-time or part-time employment with the right people and environment that we're in. This is a given, because obviously I've noticed that when I've been trying to apply for jobs in the past, that some has affected me, some didn't. Some didn't realise I was autistic, but like some of them did know I had a potential to go far and what have you, especially some of the lecturers also saw my potential, which was good. Now this is the cons list. One is we're prone to being bullied or a target of bullying one way or another. This will go for non-autistics, especially when growing up, sort of thing. But I find that many autistics, I can't remember how much the percentage, will be the ones that will be targeted or being bullied once or one day in their lifetime. I was one of them. People don't know that much about autism due to the lack of understanding, awareness, or research in themselves, because like again, as I said in my last podcasting recording, is due to the outdated information that we need to do some more research and keep it up to date. Sometimes also, number 3, people may assume the worst out of us. Just because we've got that label of diagnosis of autism, they'll think that we're a freak, we're this, that and the other, and then they just exclude us in their group, which is like, okay, yeah, fine, you assume the worst out of us, but my question is, do you want to bother getting to know us before you actually allow us in your circle? Because obviously at this point of time, I find that really disheartening, especially for me growing up. As I said, I struggled as it was trying to make friends and keep friends, even though I've only got a few that I can classify on my fingers right now that are still to this day supporting me as a friend. When we communicate to others, sometimes we don't always make eye contact, and then it comes off to them that we are either not interested, not listening, or paying attention to what is said. I have shared this about eye contact for autism. We can hold eye contact maybe for a time, and then we have to look away or whatever. We shouldn't have to like make eye contact and then stare at you for a long period of time, because it might look creepy. We might come up with as a creep or something like that. And again, in saying this, like, to me, I'm learning to make more eye contact. I've been trying to hold it longer, but then again, sometimes that makes me feel uncomfortable, even though I feel like when I do this, I have to do the terminology, as I keep saying, masking, like you guys. Like, so I have to camouflage myself or what have you, or shape shift, as you will, into your guys' environment, observe what your guys' behaviors, think that is this behavior appropriate to actually do in that given situation when I'm socializing with you. Be it example I've used in the past video is while I'm invited to a party maybe, which is very rare now, but in the past it was as well. I'll be maybe by myself for a time, sitting, observing, watching you guys laughing, giggling, or whatever you guys do when you're interacting with your own peers, and then I'll take it on board, absorbing it all, thinking, okay, while I'm scripting things in my mindset, how to say things to you guys, it's like I'm weighing up the pros and cons. Is it worth saying it all and what have you? Hey, there has been many assumptions about the lack of empathy toward others for us autistics. You'll be surprised for us autistics, we can be more empathetic than the neurotypicals. I hate to be the prejudging here, but It's true. We feel things. Well, for me, as an empath, I feel things, bad, negative, what have you, and I absorb all that energy around me, and that brings the point of exhaustion and what have you. So, like what I've been trying to tell myself, I have to be really careful, maybe who I socialise with and what have you. Seeing my struggles as a weakness, despite the fact there could be something going on me to struggle of that weakness, such as maybe a sensory overload, or I'm about to have a meltdown, a shutdown phase, or whatever it may be. And sometimes that can be a disadvantage also of the con, because then maybe I'm the kind of person that is independent and I don't usually ask for help much, and as I shared with my support person just recently, for the sake of my mental health, I need to open up more and find people I can trust to actually ask. I'm trying to learn now it's okay to ask for help once in a while. Sometimes asking for help can be a bit of a relief for anybody, especially if, for me especially, I've got big plans for myself of my projects and stuff, and I need hopefully the right people in my circle to make it happen, if you will. Next one on the list is, as I said, wearing a mask every day just to function as normal as possible. I've said this so many times before about wearing a mask in one of my video series, which I'll link in the iCard if you're watching it today. And again, downfall for that though is when this is happening, my mental health will deteriorate because of all this everyday thoughts, doubts, questions, and everything that runs around my busy brain, which is ADHD brain, not my autistic side of the brain, but my ADHD brain will start coming into effect of it. Not having a chance to gain employment to show what we can do to our future employers. This one is a big one for me at the moment. I've been getting a lot of no's, and I've been too honest in some of my interviews when it comes down to the last question of the day. When they do ask you, if we were to hire you today, what is it we need to know about you, or whatever it else, or is there anything else we need to know about you, or what have you? And to me, basically, I am doing my willpower right now to not be too cocky in that. And there is a time maybe to speak it out about if I want to bring it about my autism and what have you. I've been also told, and as a classic example, if I was to be hired, not to bring out about my anxiety and other mental health issues as well, because that might put the employer off straight off the bat, which is again not fair, because I feel in some ways that there is a bit of stereotyping and stigmatization, because I still can be a normal everyday person regardless of my weaknesses or whatever. But I shared this somewhere in one of the videos about to say or not to say of being an autistic somewhere, which hopefully I'll link in the iCard or in the description box below. Of vulnerability, this is a big one. Sometimes for me, I will become vulnerable to a point, especially when I get to the point that it's overwhelming, that meltdown stage will come. And also in saying this, of this overwhelming factor, that if I'm not careful, I will get into that shutdown phase of those meltdown stages that I've shared about. And for that shutdown to happen, it will take me a while, depending on the everyday situation and what I was doing through that day, to actually have that shutdown phase or what have you. Fear of being judged and laughed at by our peers. Again, this has happened due to this comes in the mix with not just my anxiety but my social anxiety. So basically when I was growing up and trying to socialise with the peers, when I was learning how to socialise, during or after the diagnosis, especially before the diagnosis, it's like, what is people going to think of me? How are they going to treat me? All those labels or questions that ran through my mind, like similarly to people that goes through social anxiety. Exclusions from their peers. This is quite common for many of us autistics. We get excluded from our peers by maybe misunderstandings, misgivings by the peers that, just prejudge us for who and what we are. Being rejected, obviously, can be a real big one. For many, limited ability, expensive to get the diagnosis, time being spent on the diagnosis, risk of misdiagnosis. Again, I shared about me being misdiagnosed and one of my learning disabilities, to the point that they came to stigma and stereotyping, poor follow-up, fallout, stress, energy, discrimination. So to summarize this, that there are many benefits that may outweigh the cons in getting an official diagnosis. However, there's going to be a lot of cost for you as a person who is seeking that diagnosis, such as your cost of travel, cost for doctor's appointments, cost for therapies, along with time and energy. Hear those words, cost. Key thing for anything, I believe, when I do my pros and cons list, is to weigh up every option and every little detail as possible, become a conclusion of any kind. That's why I do this on an everyday, with my pros and cons list of everyday situations, I can't force into full circle of what I'm doing. In this case, I need to weigh up, is it worth the time and money to seek again the diagnosis, or even you guys, if you decided to do a pros and cons list to answer that, is it worth the time and money to seek the diagnosis? Let's begin, like I said, to revert back to the cons, to share with the benefits of these that I shared bit of the self-diagnosis is an option or not, which you can click above me here or wait until after the video is finished and it will be listed in the description, or you can revert back to it on my podcast, so to speak, of what I shared about yay or nay my conclusion of it. Reverting back to the cons right now, again, as I said, is the cost. With cost comes time, and that within that, getting a diagnosis sure does take time, as it is not just a quick test, either with us having blood tests or whatever, to find out if we have autism, because obviously we have to go back and visit the doctors to get asked questions about our weaknesses and whatever. As I said before, some of the tests that we get tested on are old and outdated, so we need to still be diagnosed autistic to this day of those old-fashioned tests. Time. What I mean here is that the length of time it takes to get the diagnosis, as you could be waiting, as in a good example here, a good 6 months to see a professional for getting the diagnosis, and after that you're most likely to say look at into 2 to 3 years that will then confirm to you, yes, you are autistic. Money is like quite a large sum here, like thousands of dollars, which covers what I shared above and more, depending on how the individual circumstances and situation at hand. Of getting the diagnosis, as this will vary from person to person, get it done will also depend on where you're from, and this again will vary again on the costings and what they will do to actually cover the cost for you. Energy and emotions. This one is important due to the fact that before, during and after you get a diagnosis, it will be a roller coaster of a ride for you, and that we need to take into consideration this as well. These 3 situations does take a toll on us eventually when seeking out a diagnosis, not just an autistic diagnosis. Sometimes this will go for any diagnosis, for as well as in saying this will go for the energy, time and resources that is being used as well. When you're thinking to yourself, or even want to question this to yourselves, ask yourself these: how do I find a medical specialist such as a psychologist? When will I be able to find the time to do this? How much do I want to research on my own for getting the diagnosis? How will I know if the medical specialist is good or not, and that are fully qualified in that field of diagnosis or dealing with autistic patients? Am I going to trust the diagnosis? How many times will I need to see them? How much will I have to pay per visit, along with how much will I need to pay for other things such as some treatments, therapy that are available, along with some accommodation needs that I may need? Can I afford to pay for the sessions to see a medical specialist? In terms of getting the diagnosis, however, yes, there is going to be a large cost involved here to get this done. Yet again, this is up to you if you really want to get the diagnosis to be done by the specialist. As again, this is one of the many cons to consider when getting a diagnosis. Mandatory disclosure. Myself as a patient, will need to be discreet and will be willing to share what is on my records, or vice versa. So does the medical specialist, if I didn't share what my symptoms are, or even on my mind, then therefore it is like I am hiding something. So therefore it is best to share with them what is going on, that then we can get the right treatment for myself, etc. So basically there has been certain rights as a patient to disclose information. So the very first one is just to cover is the rights of adults with capacity to make their own decisions. As a principle, adults who have capacity are entitled to make decisions on their own and their own interest, even if others consider those decisions to be irrational or unwise. You should usually ask for consent before disclosing personal information about a patient if disclosure isn't required by law and is practicable to do so. You can obviously do this with your medical professional. If an adult patient who has capacity to make the decision refuses to consent to information being disclosed, however, that you consider necessary for their protection, you should explore their reasons to why this is that they didn't want to disclose the information. It may be appropriate to encourage the patient to consent, but to the disclosure and to warn them of the risk of refusing to consent to you. You should, however, be able to abide the patient's refusal consent of disclosure, even if their decision leaves them but no one else at risk of death or serious harm. You should do your best to give the patient the information and support they need to make the decisions in their own best interest, for example by arranging contacts in an agency to support people who experience domestic violence. Adults who initially refuse offers to assistance may change the decision over time, so don't forever rush them into it. Disclosing information with consent. You should ask for patient's consent to disclose information for the protection of others unless the information is required by law or appropriate or practical to do so, or if the omission will. You may consider any reasons given for refusal. Let's share some of that based on the other topic, which you can listen to or watch above here or below here. When they do diagnose adults, as also knowing that also for women to get the right diagnosis, as I found that women are hard to diagnose with this condition, as it overlaps with many diagnoses that I have again shared briefly to this one in one of my videos, which again will be listed below me once this comes live. If someone doesn't know for you and that they end up misdiagnosing, then may therefore should be looked again by another person. I had heard a lot of stories of people being misdiagnosed by specialists. They have to again waste their time, money, energy to find someone else to diagnose them properly. There need to be more than just a diagnosis to make it happen, to get it officially known that you've got autism. So again, based on the list that I did on my benefit, is knowing that you're not alone after getting the diagnosis, finding the right people in the community of autistics to support you and guide you is really a great feeling with the certainty of knowing that, for example, in my case, I had Aspergers syndrome, and that is now classified in the Autism Spectrum umbrella. That then allows me to be confident and being able to focus more on myself, to become a better person, or learn more about myself and the condition at hand. Now, having the diagnosis gives me the ability to speak my truths, as I shared before, as well as my lived experiences with autism with others around me on and off the spectrum, in the community and out of the community when the need may arise. This will then give the approval or validation to feel a certain way every day, as well as instead of before getting the diagnosis, of feeling of doubt, self-dread, and other mixed emotions that I had at the time that comes in the territory with it. Being able to also, when being diagnosed with autism, allowed me and others to find some support networks and groups in the community to help us to feel that we belong, that we're accepted of ourselves and others around us that will be accepting of us. Sometimes it's under the relief category. After getting the diagnosis, then the questions come to many of us, what's next for us? With me, when I did get my diagnosis, I didn't realize that before I was almost transitioning to an adult, that there was only a small group and organisations will help me if I need to, along with any accommodation needs to be met. Again, I shared this, there is very limited resources, groups, and more so for autistics, and that is sad really, as I believe that we need to do more to achieve the more accessible. With that being said, however, I would always be in my books, no matter what they are. I will read and read until my head is full of information, until it hurts while I'm soaking up the information. As we know, with knowledge comes power and wisdom to share with others, no matter what the situation or circumstance is. I actually don't want to use the term label, as I said. For me, being a person with Aspergers syndrome is, to me, that feels like I am needing to be labelled with different terms, etc. I'd rather say that I'm happy that I'm now coming to terms of my diagnosis. I have shared my thoughts on labels, which you can then, again, click above me or below me once this goes live. I felt that this is now that I can be able to be in the autistic community, join and have a discussion, etc. with my peers. Should I self-diagnostic autistic get a diagnosis? Maybe. This is, however, really up to you. This is a no life sentence for us, however, once we get the diagnosis as being an autistic. This is all about learning about ourselves and others around us. We should be able to love ourselves and others around us and feel that we're accepted and included in everyday things, that no matter what is going on. Yet we still need to be understood by others, as well as being to be able to understand ourselves. Don't be afraid to keep looking for the answers you're looking for, especially if you suspect that autistic. That maybe in the future there will be some different methods to be had to help the diagnosis process in them. So in saying this, also it's important to know that in my life the cons are mostly external factors about how autistic people are perceived or treated, and are very much dependent on where and when you are. The pros, however, on the other hand, are more internal factors about how you perceive yourself in a relationship with others around expressing your own identity. Perhaps the key question around diagnosis then is, how much leeway do you have in your current personal and working life and your social position to deploy your knowledge about yourself? How much do you want to know, or how much do you need? A society focused on the individual as ours is in favour of facilitating this, that controversially is also exploring the idea that there are people who may need support or who may not contribute in the approved way. Also, what is true in your situation now may not be true in the future. These are just the paradoxes we must negotiate when taking on something as complex, as potentially liberating, as potentially oppressive as an official autism diagnosis. I'm aware that this is a complicated privilege for some of us. I was able to afford a little bit of it at the time. Many people are not, or end up going to professionals less trained in the ways adults women are presented. Self-diagnosis is valid, however, there's a very strong argument that we shouldn't need medical diagnosis for something that isn't a medical condition. Possibly there needs to be an alternative identification process, that is often people feel the need for confirmation from someone else before actually doing it themselves. So the main part of this video I want to quickly hopefully address, if I can aim to finish today, is, what is Patreon? You may be asking me. Patreon is a service or a membership platform for content creators like me that are creating vlogs or music vlogs or whatever form of outlet that they're doing, sort of thing, to pay a monthly fee towards as you guys decide to become a patron on board, sort of thing, to hopefully work towards anything that we want to do, be it behind the scenes, exclusive videos, what have you, live videos, and whatever it may be. My sort of reason for you want to support me is just based on what I shared with you, is to educate and navigate through life with autism and mental health, along with also mentoring, supporting you and the like, as I said earlier. Also, I've been saying this with the Patreon, you get certain tiers based on a certain amount that we put in, and within those tiers I will have certain things that will hopefully correlate, so to speak. So when you pledge to me, this will cover, obviously, for what it will cover either the cost of my rent or backup supplies of my future endeavours endeavours of what I'm doing right now that I'm going to share more of in the next video, which is my website creation versus my designs and some equipment I might need if I do create it as a business from home instead of via through a spreadsheet. If you've seen those, that some of those might be in my home business. I haven't decided yet, but again, this will be addressed in my video. Another cost that will cover, basically, it will be my recording equipment via through doing vlog or even more on my podcast, as well as in saying this, maybe in the future for that equipment, it could be maybe a new PC that I'm dying to need, as well as a new cell phone and whatever, as well as I'm saying that cover the cost of travel if I need to do some through my training in educational purposes of becoming an advocate, support person or what have you in future to upskill my training if need be, because I've noticed that obviously in some places we need to actually, you know, train instead of having our lived experiences to be actually shown that we can do the work. Also from saying this, it will cover the cost of my merch creations versus also via through the merch. If I, you know, have a certain amount that I decided that some of the percentage will go towards either one, to schools locally around New Zealand where I am in the middle, to maybe put forward to education specialists or what have you, to gain a better understanding about autism, especially where I wanted to do it, and also in saying this, maybe to create an educational program or some sort of program and create resources that is valuable to people to know about autism and so on and so forth. And also in saying this, maybe just cover the cost for certain medical specialists. That's where hopefully all the funding will go. As you know, there is always has been a continuation of change, hence why on YouTube it is harder these days to monetize, obviously due to their, you know, monetization process versus their analytics and everything else behind the scenes. So many of us content creators at this point in time are trying to find solutions to raise our own funds and do what we love to do the continuation work of what we do, regardless if it's music, where what I'm doing right now as well. So in other words, also to end this, feel free to check my blogs and everywhere else to support me anyway, big or small. If you want to become a patron today, that is jolly good. If not, I'm not going to be disheartened. It's up to you at the end of the day if you really want to support my projects and causes that I'm doing. Also in saying this, basically, as we know that this is important to me, obviously, to raise awareness and understanding about autism and mental health, especially again with the spectrum of autism, because obviously many of us autistic just feel that we need to be accepted, because we feel like many of us will get rejected by our peers by the misunderstandings, misgivings about autism. So hence why I'm trying to stand out like it's all fun somewhere as an advocate, a voice for you all, regardless of what it may be. So that also in saying this, basically, I'm hoping with the content that I'm creating with you all, with the amount you pledge every month, that will go towards that and many other projects in the works later on, and make better content for you all, regardless of it all, as well as in saying this, to gain a better confidence level for myself, or in myself, and what I want to strive and achieve for, which is what I keep saying about, you know, raising awareness and understanding. By supporting my cause and my channel and either the future projects or what have you, regardless where you'll find me, I believe wholeheartedly we will work together to break the stigma and stereotyping of autism and mental health, as well as just removing or reminding you guys that autism isn't a disability but a different ability, as well as continuing to educate you all while navigating through life with autism and mental health. Create a better life as well for myself and others around me by supporting all. So just a quick shout out of the very first patron that has been my lifetime member is Mum Noise. I'm hoping I'm pronouncing the name right. Correct me if I'm wrong. This person is watching today. Appreciate this very much, and hopefully within saying this, that some of the, like I said, pieces of funds will go towards my future works of what I have to do. And also to everyone that I have been associating with from the very beginning of my vlogging journey right through to now, I appreciate wholeheartedly with some of your support. I know I have been having a lot of naysayers along the way of what's been said about what I can and can't do, and that I have proved them wrong, obviously. And in saying this, based on this, your support, love and guidance means a lot, you know, and that I wouldn't know where I'll be today with some of you that are still with me today, regardless what it may be.